Ladies and gentlemen, welcome to the Making Your Mark podcast. I'm your host, Mark Bundang, and today, as usual, actually, scratch that, not as usual. This one is super special to me because I have as a guest one of the most important people in my life. Her name is Kim Gutierrez. We're as close as family as can get. We've grown up around each other. We've played with each other when we were kids. You know, our moms were best friends. Our dads were best friends, and I played with her brother. We go back a long way. This one is, as I mentioned, very special to me because I've been looking for a way and an opportunity for not only to tell a personal story that's close to my parents and my culture as well, but nursing. Nursing is something that Kim is a master at. She won't
I
admit
wouldn't
it,
say
but she is.
master, but yes, in the field for a while, for a long time.
There's the Filipino modesty as well. Yeah, that this is like the Filipino heritage, especially coming here as immigrants to Montreal. Our parents or our moms came in the mid 70s or early to mid 70s, migrated to Canada and eventually to Montreal and worked at some point where everyone seems to work at the Jewish General Hospital. If you come to Montreal as a nurse. So Kim, the tradition here is that we give the guest a chance to kind of tell a little bit about their background and also where they feel they made their mark. So if you can, please let us know.
Our mothers came from the Philippines, studied in nursing, and the reason why in the Philippines nursing is a big culture, it's because yes, as Filipinos, we want to help people. And then with this job, it gave them a lot of opportunities to move abroad. Better life, better stability for their family. And this way, they're able to work, earn money, and then they send money back to their family in the Philippines. Filipinos, I think they love nursing. Honestly, they love nursing
Mm.
because they want to help people. And for me, growing up in a household where my mom was a nurse, telling her stories about her experience as being a nurse has shown me sides of nursing, the good and the bad. And therefore, when I went into nursing, I was able to relate. Before, when she was telling me the stories, I'm like, no, that can't be true. That never happens. That can't be right. And then when I actually experienced, I'm like, oh my gosh, my mom was right. My mom was right. The good, the bad, the hardships, and then what they experience. Because as you know, nursing is 24/7. How my mom, my aunts, my cousins, how they did shift work, how they were able to manage their shift work with and balance it with family life. And then after that, going through rotation of shifts to bringing me, you, going on vacation, trying to put, because we can't get vacation all at the same time, but them trying to get vacation at the same time so all of us as a family can go on vacation and enjoy, really inspired me. Then I want to try and do this for my family and try and be like my mom. And that's what I think brought me to nursing, to study nursing. That was one of the factors, is that I wanted to be like my mom.
Oh, and listen, I remember your mom. When my mom wasn't around, she was my mom. You know what I mean? So I certainly understand like how the values, the Filipino values and the kindness and the duty of care, those values are so intertwined with nursing that I can see how it's passed not just from our parents' generation, but also to you as well. I wanted to ask you, like you were inspired by your mom to be a nurse, and as many other Filipinos and Filipinas of our generation have done as well. Is there a particular way to get into nursing that most people or most Filipinos would do?
No, not there's not generally an entry point here. I'm going to backtrack. Originally, I did not want to be a nurse. Okay? Because sometimes my mom's stories would scare me. So I did not want to be a nurse. But then going into school, And then studying in the health and science field and the marks that I had to get, I was just pretty much tired of school. I was looking in CJEP. I go, what are programs that I can go that can bring me to the workforce right away? One of them was computer science, the other one was dental hygiene, and another one was nursing. So I said, you know what? I'll give it a try. It was easier for us to go into nursing in CJIP, do your 3-year program, and then you're able to work right away. That's what kind of pushed me, because then I go, oh, I don't have to study. I don't have to study after my 3-year of CJIP. I'm able to go to the workforce and earn my money, earn my keep, and start working, because I was honestly tired of school. But then while I was studying, I enjoyed it. I enjoyed, seeing the different services such as surgery, emergency, um, the birthing center, and just to see the nurses helping other people through their struggles. And so when I finished in CJIP, I worked right away. I worked in emergency and I really liked it. That was my forte, that I was able to multitask, able to learn quickly. Different people, different nurses have different qualities. Some people can manage elderly people, some people can manage the birthing, helping women give birth. Other people are specialized in psychiatry. I'm more of the critical care, emergency, fast paced, in and out kind of routine. So that was my forte, and I like that, being organized and having the patients. Okay, we were able to help with your problem. Where do you go now? You're discharged home, or you go up to the floor for your surgery or whatnot. That's what I liked. And so with that, after, it gave me opportunities. Do I want to continue still working or go further with my studies? And then then I'm like, okay, I worked. And then after that, then I said, okay, I'm going to do my bachelor's. And I was able to do my bachelor's at the same time. And I did my bachelor's in the University of Ottawa. Yeah.
Now, that is an interesting little tidbit, because I want to frame it for the audience just a little bit. For those of us who are not in Quebec, right? Some of the audience members may not be from Quebec. There's a system that we have here called CJEP, or college level. It's a 2-year or sometimes 3-year layer, depending on whether or not you want to take a path to university. You took a 3-year program, right? And then you could have stopped there and still be a nurse.
Yeah, I did. I actually did stop and became a nurse. I graduated and became a nurse and was able to work in the hospital as a nurse.
You're a graduate nurse, okay. But why would you go back into your bachelor's? I mean, that's a lot of work.
So I was young still, and one of my decisions of going back to school was that having your bachelor's or pursuing your education further gives you more opportunity on different fields of nursing. So if I wanted to move up, if I wanted to be a assistant head nurse, if I wanted to be a head nurse, if I wanted to be a director of nursing, just moving up in the field, up in your experience, you need the education because those are the requirements. A graduate nurse will allow you, like graduating from CJIP, will allow you to be a nurse, work in the nursing sectors. However, specialized nursing, such as being a nurse manager, or being a nurse educator, requires you more education. So, since I was still living at home, I said this is my perfect opportunity to do so because I didn't have to pay a mortgage plus school, so at least I just focused on school. So I did my bachelor's in Ottawa, University of Ottawa, with a couple of coworkers from my emergency department at the Jewish General, and we did our bachelor's in 1 year. Usually, it's about a 2-3 year program. We did it in 1 year because we maxed out our studies and our credits. Like we made sure that we urged each other on. We helped each other on to, we can do this. Let's study together. Let's work together. And we were able to graduate in a year.
Wow. So, but you were working while you were doing this. That sounds like a crazy schedule.
It was. I don't know how I did it. And our first semester, me and my coworker, we went back and forth. We had no place in Ottawa. So we would do our classes, we would come back home to Montreal. Then after that study, go back. We would go to class in the middle of the week, and then we would work on the weekends, 12-hour shifts.
12 hours. Wow.
12-hour shifts so I could maximize my hours, and also it's helping me pay for school as well.
Wow. Wow. You're not afraid of hard work, are you, Kim?
No, but my reasoning is, okay, it's going to be tough for this first year, and then after that we graduate, and then we'll be okay. We'll be free. We don't have to study again. So take advantage, work, you work hard, and then after that you'll be able to relax. That's my motto.
So you did the program, you worked a little bit, then you decided to do your bachelor's for the reasons that you've mentioned. You graduate from the bachelor's degree. What happens after that?
So while you're working with a bachelor's degree, you get opportunities. So do you want to be, so there's opportunities in the hospital where they post positions, assistant head nurse, nursing educator. So with that, one of the qualifications is at least a minimum of a bachelor's degree. So since I have that bachelor's degree, I'm able to apply. While my colleagues who only have a DEC certificate, that's nurses who graduated from CEGIP, they can only remain in the nursing sector. They can't kind of move up because of the requirements of the position. And even some clinics, they require a bachelor degree. But I can honestly, the bachelor's program is helping you be more of the managerial level.
Okay. Because it's a requirement.
It's a requirement,
of that
exactly.
position. Okay. I got it. Okay. And for you personally, what happened after the bachelor's degree? What did you pursue?
Me and my friend, we said, you know what? Why don't we do travel nursing? So we did that. We just applied. Next thing you know, we're packing our stuff and we're heading to Connecticut. Because back then, in 2000s, there were certain states where you didn't have to pass what we call the NCLEX. I forgot what the NCLEX stands for, but it's the exam that they use in the States. So there were certain states that took reciprocity with our Canadian license. I think it was North and South Carolina, Connecticut, Minnesota. There's just a few. So one of the states was Connecticut. We went and I did travel nursing for about 3 to 4 years. I can say that was one of the most enjoyable experience I did.
So what is travel nursing?
So travel nursing, that's what I like, because with my background, when I graduated from nursing, I went into emergency nursing at the Jewish General Hospital. And like I said, it depends on how you work. I like that, okay, the in and out kind of patients where I have to know what's happening with my patients, being organized, multitasking. That's what I like doing. So with travel nursing, you are hired by the hospital on a contract. It's not where you're hired like a regular nurse where you get how many weeks of orientation. With travel nursing, you get 2 days orientation and then you're on the floor. So you have to know your stuff. The 2 days orientation is just to get you familiar with the unit. Okay, this is the flow of the unit. This is how, when we admit a patient, how we discharge a patient, where the medication cabinet is, where the medical supplies are. After that, you're on your own. You should know when a patient comes in, like with this type of diagnosis, what you're supposed to do. I liked with the States is because they pay for their nurses. They entice the nurses from all over the world to try and work in their country. So they give incentive bonuses, which is a sign up bonus when you start, or a completion bonus when you finish. Their hourly rates are better. They give you good benefits. They pay for your housing or they pay for your stipend. I really enjoyed my experience as a travel nurse because I was able to travel in different states and meet different people from different parts of the country in the States, and or Canadian nurses who came down and started working in the States. There was one hospital where in the emergency, the only nurse who was an American was the charge nurse. All of the other nurses working that night shift were all Canadian. So it was good because our camaraderie was very close. We were able to spend our Thanksgiving in October together, and when it was the American Thanksgiving, we all worked. As Canadian nurses all worked so they can go for their Thanksgiving. It was really fun, and then we were able to see the ways nursing is different and how the hospital system is different from the States compared to Canada, or I can only say Montreal because I haven't worked anywhere else in Canada except for Quebec. But the different ways, because like here, we have free Medicare in Canada. In the States, you have to pay. So us nurses have to charge each item, each procedure on the patient's file.
Okay. Okay. So you saw firsthand the difference between the American and the Canadian system. And I guess one thing I would ask too then is, as a consequence of the way it's funded, is the quality of the healthcare that you get different between one or the other?
I only know what's in Quebec. So I can only compare with Quebec the quality of the healthcare compared to what it was in the States. And yes, you could see when you pay for medical treatment, you're getting what you're paying for. So your tests are faster, or you're being seen by the doctor faster. The equipment that we use is more up to date. And even the hospitals, they're big about promoting. Obviously it's a business, right? Promoting their hospital so people can go into their hospital. Just even their cafeteria was huge, with an ice cream bar, with a low carb pasta station. And there's even a laundromat because patients, not a laundromat per se, but dry cleaning store, because patients who have their belongings, who've been in the hospital for quite a while, want to wash some of their clothes. They would bring it downstairs. There was even a hair dryer and nail salon. I was impressed. We have patients here in Quebec who stay in emergency for sometimes 3 days. In the States, when I was working, I don't see my patient the next day because either they're discharged or they're up in their room already. So I don't see a patient for 24 hours when I was working in Emerge, because I worked in Emerge when I was in the States.
Okay. Okay. And does that affect who can use it though? Like if you have to pay as you go to use the hospital, does that affect who can access that healthcare versus not?
I'm not the expertise in the insurance part, on the billing part, but you can see with the hospital care, they will take all patients and manage, but then I don't know what comes after. If, let's say, this person requires this type of procedure, can they afford it, or will they give them the minimal? I don't know. All I know is that when I was working in emergency, when I was working in cardiology and med surge in the States, we did everything we can, but I don't know if there was anything further that was offered to the patient.
That's fair. That's fair. I guess maybe still talking about travel nursing a little bit. Uh, what is the biggest takeaway about your experience in travel nursing?
Travel nursing is being able to go to a unit or go in a contract and being able to get your orientation in 2 days and be able to work. Because our minimal contract is 13 weeks, which is usually 3 months, and being able to excel in doing that job. That made me good about myself because I was able to say to myself, wow, you can do this. You're able to pick up what's going on, pick up the flow of the unit, pick up, what needs to be done on this patient quickly, and be able to care for this patient accordingly and appropriately. And then also meeting new people. It's not just regular nurses from that state. There's also other nurses from different states. So when they say, Kim, come and visit me in Philadelphia, come and visit me in Maine, I was able to go. We were able to go and, have friends there and be able to see their state. So I really enjoyed that aspect of travel nursing.
I wanted to move on to another experience that you wanted to share.
In 2020 was obviously the start of the pandemic, COVID. And back then, I was a nursing supervisor, but I had to cover the bed flow manager. So while she was on vacation. And during that time, that's when the COVID started. No one knew about COVID. Everyone was very afraid because we only got like that one or two patients, but we didn't have any in Quebec yet. Then when I was working, as with my luck, patients started to come, but then they'll be like, okay, we have this patient. Is it COVID or not? Because they did have symptoms, but it ended up being no, they weren't. Then we did have that one patient from Quebec that was COVID positive. But the hospitals, there was only two hospitals in Quebec that were equipped to handle these type COVID patients, which was the Jewish General Hospital, which is where I worked, and Quebec City. So this patient ended up coming to our hospital. So before that, there was three of us, me, the bed flow manager, and another nursing supervisor. We developed an inter-hospital transfer form that was sent to the sending hospital, of like a checklist of what needs to be done. And also this form was also for the hospital or the unit receiving the patient, what their checklist is to be done, so we can get report and make sure that the transfer went smoothly. So this happened on my shift where I admitted the first COVID patient at the Jewish General Hospital in Montreal. So I received the call, I admitted, I informed the unit. So we were just waiting for the transfer to happen. So it was a big thing. And then when the pandemic started to evolve and we got more cases, we had this form that we developed was actually adapted, or they asked us, is what we call Coolsy, which is like a head, not a head office, but a place where they're getting calls from different hospitals so they can distribute the patients accordingly, like to different hospitals. So they asked us at the Jewish General, can you please give us that form? Because this is the form that we want to adapt so we can send it to the other hospitals so they can use the way you do your inter-hospital transfers. So with that being said, I was like, wow, they wanted to follow the way we do it, and with the three of us, the one who developed, we're like, wow, we feel proud about ourselves because it's not just our hospital. Now it's being used across Quebec. And
Amazing.
so this was really a stepping stone that, you feel proud about yourself.
Well, I imagine so. I mean, at the time, this was probably what, early 2020,
2020
correct?
March.
March of 2020.
March,
So
April, yeah.
this, now I remember a little bit about that time as well from speaking to you. And I remember you talking about how you guys are preparing, you're thinking about it.
We're all thinking about, okay, that's what happened before we admitted our first patient. Yeah, we didn't think it was going to get this big. So we just had a few beds assigned and we were looking, okay, how do we prepare? Then on the units, okay, we're only going to prepare 1 to 2 beds for COVID patients. But we didn't realize how big it was going to get, where we had to go from 2 beds up on the floors to 10, to the whole unit, to having closing three, like I think it was 3 or 4 units just for COVID patients. Actually, it was an experience that I will never forget, how the hospitals had to manage COVID patients, how we had to decrease services, how we had to transform units to COVID negative pressure units. And then what was sad about it, how many patients passed away from COVID?
Hmm.
That it was very heart-wrenching because I was also nursing supervisor, and sorry to be grim here, but my morgue was full.
This thing is huge, right? It's spreading like crazy. The effects are very devastating, and you have very little information. And then what you see is people who have died from it, right? Or it's suffering, lots of suffering, right? How do you balance the emotion and then still do what you have to
I know
do?
it's hard because you see that, you see patients passing away, you see the families going through this, you see some of the family members, no, I don't want to wear my mask, no, I don't want to follow the protocol here. It's not just for you, it's also for the rest of the population. And it's just talking to them, trying to understand them, trying to empathize sometimes of what they're going through and what fears they might have, and trying to help answer their questions. But then on the bright side, we were able, that first patient that came from La Ronzielle to the Jewish General Hospital, we were able to discharge that patient. Was very sick, but we were able to discharge that patient home. So that was a good feeling.
We know that the pandemic didn't just go
No,
away
it didn't
after
just
a
go
few
away.
months. So how did other nurses manage that time?
It was tough on everybody because when it was full scale COVID, some of the nurses couldn't go home. There was hotels that were just dedicated to healthcare professionals so they can go there and sleep there and then go back to the hospital. It was very tiring because we have what we call dawn. You have to wear the full gear, the face shield, the N95 mask where you can barely breathe, the gloves, the booties, and you're there for your whole shift like that. The only time you take it off is on your break. So it's not where I can go outside, get fresh air, come back, because it's a big process to, dress up again and then to take your gear off again if you want to go back outside. Some nurses were psychologically scarred from it.
And I imagine not all the nurses going into that pandemic made it through to the end, right? Some of them left the profession.
Some of them left. Some of them said, you know what? I can't do this anymore. I can't do this anymore. I'm going to switch fields.
And how did you avoid that?
I just kept myself occupied by my coworkers. We talked about it, we vented about it. And then with my late husband, I was able to do that too, vent at home.
I think this is a reflection too of how do I put this? And I can only speak to say maybe the Filipino nurses. Like there's something about the way that Filipino nurses are built that there's a certain resilience, and I don't know if that has to do with the culture or because either they're immigrants or they are the offspring
Yes.
of those immigrants. Did you find that the Filipino nurses were, or immigrant nurses for that matter, not just Filipino, but was there a difference in resilience from the say the other?
I did notice that. I mean, I can only speak for myself as a Filipina nurse. Yes, I found that there was a resilience. Let's work, let's help these people, and let's be strong for each other. That's why with my friends who were also Filipinos and also with my family, we were able to talk about it with each other. We were able to be like, okay, you're strong, you can do this. And then also bring you up, okay, you did well, not just bring yourself down, not just think about all the negative about the
Sure.
pandemic, but also think about the positive. Okay, you're helping these people, you're helping them get to the hospital, you're helping the other nurses get through this.
I don't want to turn this into a religious thing as well, but I think a lot of Filipinos also have a faith that keeps them strong as well. That's also a cultural difference.
It is. Every shift, before I start a shift, like you said, Mark, this is my faith, this is my culture. I pray. I pray that God will get me through this, get me through the shift, make me strong, and help not just me, but also help others get through this.
Well, I know that growing up, in our background, I know that was very prominent. I know you're not the only one who does that amongst the Filipino nurses out there as well. So say what you will. I mean, religious faith, whatever, what there's a difference that's made when you see that. There's a correlation in terms of resilience and being able to take the challenges that are with you with the people who actually have this faith. If I could ask you, what's the big takeaway for you from that particular experience with the COVID and the first patient transfer and all that?
My big takeaway from that experience was that working together as a team, working together to try and see how we can overcome this big pandemic, big problem. And then after that, seeing it come all together, putting out ideas, and then putting it all together to try and make this hospital, this unit, a place to be recognized. That we were recognized as the first hospital in Montreal to accept a COVID patient, one of the first hospitals at the Jewish General to have all a negative pressure unit. That with that being said, it forced the other hospitals to get into gear and to get set up because they were trying to benchmark the Jewish General Hospital. And then to have them say, okay, can we borrow your form, how you accepted other patients from different hospitals? To have them say, what did you guys do at the COVID? Because we need help. So we gave them ideas. That's what I liked, was that, okay, how did you guys do it? Help us, teach us, show us. And then to see how we were able to help many patients get better during the COVID.
Moving on a little bit from the COVID experience, I think you have one more to share, right? I think this one is more related to the care of your grandmother.
So when my grandmother was sick, when I went into work, I would make sure that she's tucked, because I worked nights back then. I would make sure that she's tucked into bed properly. And I would work, do my night shift. During my break, I would go upstairs. I would turn and reposition her, make sure she's okay. After my shift in the morning, I would go upstairs. I would wash her. I would feed her, and then get her ready for her physical therapy. So this is still after my night shift. I'm still at the hospital. I haven't even gone home yet. And that was also with my mom. When my mom was hospitalized as well, I was there to help my mom because I'm the medical person. My brother wasn't, my dad wasn't, it was me. Kim, you need to be here because the doctor's going to come and speak to us. So I have to be there to translate the medical lingo that they might not understand. So it's very hard because we're very short staffed. Nursing is very short staffed and very busy, that they might not have time to come and see their patient or my family member in time. So I'm helping them. I'm helping my fellow coworkers. I'm helping my fellow nurses, trying to alleviate some of their workload. If I can do it, that gives them time to help other patients. Maybe it's my upbringing, maybe it's our culture that we help our family members. I will do what I can to help you. And I don't need to just sit down and wait for the nurse to prop my mom up so she can sit up for her meal. I could do that. Why do I need a nurse to do that? I don't need a nurse. That's what sometimes I feel, that we're not glorified maids. We're not glorified, nannies here. If we can get that help from family members, that's greatly appreciated, because that will give me time to get your family member their medication or their pain medication, or help another family member who is, not doing well in another room. But if you're calling me just so I can prop I don't know, your mom or your dad up in bed so they can eat their meal, that's sometimes the downside of nursing for me. But when I was helping my mom and my grandmother in the hospital, to have the nurses on the floor saying, thank you, Kim, for all your help, I'm glad that I was able to help them, because they also work hard. It doesn't matter in which unit you're working at. The nurses work hard. The nurses are busy. The nurses are overworked and sometimes stressed out. That any little thing that I can do to help them, whether it's washing my mom or my grandmother or setting them up for their meal, I'll do that. I'll do that just to help them.
I'm not saying everyone is like that, but there's probably this mentality that, well, you're a nurse, that's your job.
But that's the thing. That's what it is. You're a nurse, that's your job. My job is to help. I'm here to help you. I'm here to take care of you, yes. But propping them up in bed doesn't require a nursing degree. Doesn't require a nursing degree to put a pillow behind their back. Putting their food tray on their table doesn't require a nursing degree. You're able to do that as well.
I guess what really hits home for me is that message that whenever you're asking a nurse or telling a nurse, do that little thing that you could do, you're taking away from time that they could be doing with higher added value activity.
That's why I said I will do what I can so you can get my mom's pain medication, help somebody else who is not doing well in another room. I could do this part. I'm not here just sitting down and reading a magazine beside my mom or my grandmother. I will do this so you can do something more important, like getting the medication ready for my grandmother or my mom, or helping that patient who is screaming in pain.
And I think this message is very critical. And I'll tell you why. It's because in a time when we are shrinking in terms of nurse power, we're losing more than we're gaining, I think.
We are losing a lot more nurses, I find now. Like they said, they're going to different provinces, they're going to different countries, they're going through to different fields, not even in nursing. How can I put it nicely? It's very hard to put it. Sometimes we're not recognized enough. A lot of times it's blame the nursing. To me, I don't think it's, oh, blame the doctors or blame upper management. It's always blame the nurses. We can't do this because there's no more nursing. It's not that, because we're doing so much work and we find that we're not appreciated in the field. The nurses don't get recognized for their hard work and their achievements, I would say.
What kind of recognition are you seeking?
Recognition, meaning for me, is this nursing team is great. We work hard. We are managing all these patients with what we have, and without them, this unit hospital will not be functional. None of that we see.
So the form of recognition you'd like to see is an acknowledgement of that.
More the acknowledgement. I would like also our work to be recognized also in our salary, not gonna lie, because we're one of the lowest paid. We do the same amount of work that you see in Ontario and you see in Vancouver and also in Manitoba, and they're getting paid way more than what we're getting paid. We're fighting so hard. As you can see, we do strikes and everything. We're doing 24-hour shift work and we're getting paid peanuts for it.
I heard that the medical doctor specialists, on average, they're the highest paid of all the provinces here in Quebec. But you're saying that on average, the nurses here are the lowest paid or one of the lower paid ones. So there's a bit of a disparity.
They say that it's because of our cost of living. However, our cost of living has gone up. Our cost
Yeah.
of living, inflation and everything, especially after COVID.
But that doesn't explain like the higher specialist salary, you know?
No, that's why a lot of them are specializing, either getting their education to specialize in different types of nursing or getting their certificate, or they're moving, or they're going to private sectors, private hospitals, because they will pay the nurses. In public, it's very difficult, but in the private, they're getting paid and they don't do shift work like what we do, or they're going through agency because the agency will pay them.
So I'm going to ask you a choice to pick the one that you feel is the most critical to address first. I'll give you three choices: the quality of the environment in which you work, the salary and the benefits, or an acknowledgement and respect of what you do. Of those three, which one is the most critical to address?
The salary.
Yeah. So you feel like that's the one where we're furthest away from where we need to be.
Yes, the furthest away where we need to be, because I think that for the government here to entice the nurses to work here and to retain our nurses, you need to pay us. You need to pay us for I'm sorry, for the hard work and the long hours that we put into care for the public. Like for me, I'm salary. I'm paid one salary, that's it. But I work long hours. I work after hours, I work on the weekend. I'm middle management, I'm a head nurse now. We don't clock in the overtime. We just work because we have to make sure our department is functioning.
Okay, so here's another question for you. If someone is considering going into nursing now, what kind of advice would you give to that person?
This is if you're the type of person who want to like to care for other people, who want to see sick people and then make them better, and to be involved with medical, be involved in medical decisions and everything, then go into nursing. Nursing gives you plenty of opportunities to go where you want, where you feel that you can grow. Like if you want to specialize in a different specialty, like if you want to specialize in psychiatry, if you want to specialize in family birthing, if you want to specialize in emergency, and then with that, you're able to travel anywhere in the world, because the whole world is short of nurses. With your experience, you're able to go anywhere. You're able to work anywhere, and they will hire you. If you specialize in dialysis nursing, there is dialysis cruise ships where they need nurses, because dialysis patients do want to go on a cruise on vacation. They need nurses on cruise ships. So going into nursing gives you plenty of opportunities to travel around the world and work wherever you want to work. This is why nursing is big, is because if you want to go places, see places, and work in different hospitals, you have that choice.
Okay, good. So there's a high demand as well.
There's a very high demand, especially in the States. They will pay you. They have advertisement to go into nursing. They will give you a car if you want, because they want to get nurses, or pay for your housing for 1 year because they entice.
As a follow-up to that question of what would you give as advice for someone who wants to go into the nursing field, what is something that they must accept as a trade-off?
The shift work. When you first start, it's not going to be, oh, it's a Monday to Friday job, day shift, anything. You do rotation of shift every second weekend. You work on the holidays. We're not closed during, Christmas and New Year's. We're not closed every weekend unless you work sometimes in the clinic. Starting off, yes, you're going to do that shift work. You're on the bottom of seniority. Everyone's going to be on vacation on the construction weekend, so you can get that summer off, or everyone's going to be off during spring break or Christmas holidays. No, because we're open 24/7, the hospitals, and caring for patients is a 24-hour job. We need nurses, we need hospital employees to keep the care going. So you have to start at the bottom and then work your way up.
So I think, you know what, Kim, I think this has been a very great conversation.
Thank you. I hope I didn't ramble on so much. And I do want to encourage people, go into nursing and see how it is, see that they can make a difference in helping patients and helping other people. And then after that, if this is what they want, they can also have the opportunity to go anywhere else in the world and work cruise ships, different countries, different provinces. And I think then they'll be able to feel good about themselves.
How do people reach you if they're compelled by your story?
So they can always reach me I'm on Instagram, I'm on Facebook. They can even go through you if they want. And yeah, if there's anything that I can help them or help answer some of their questions, I'm willing to help them and even guide them through, or give them some hints or tricks or some advice of which path that they might want to go and venture out to.
I do want to close with this, Kim. So this has been a very rewarding experience to have sat with you and have this conversation. Now, clearly, you're a person of great care. You care deeply, and I think it fuels you during times when you have to be really resilient in such a hard but rewarding field such as nursing. And for me, I have the utmost respect for you as a nurse, as a professional, but also for you as a human being.
Thank you. Thank you so much. I appreciate those kind words.
As we opened in this conversation, we're family, and I can't think of a better example of a nurse than you.
Thank you. But I mean, like I said, there's a lot of aunts, uncles, my friends who are nurses, and I learn from them. Our moms, I learn from them and listen to their experience, listen to my friends' experience, and then that's what helps you grow. That's what helps you try to become a better nurse.
Thank you, Kim. Thank you so much.
You're welcome. Thank you for having me.
Have a good one.
You
Take care,
too.
everyone. We'll see you on this one and the next. Take care. Bye.
Bye.
Hey, thank you very much. If you made it this far to the end of the podcast, I really want to thank you from the bottom of my heart. You know, we're just starting out, so it would help if I could just ask one more thing of you. Please subscribe to this channel and share the podcast, share the episode on any platform you can. It would mean a lot to me and it would help us a lot. Thank you.